Hello friends, my name is Dr. Jaydeep Varinskar. I am an ophthalmologist and a senior vitreoretina surgeon. I practice at Aditya Jyot Eye Hospital, which is a unit of Dr. Agarwal's Eye Hospital located in central Mumbai at Vadala West, opposite SIWS College. Today I will be talking to you about a common retinal condition called diabetic retinopathy, which has potential for blindness if undetected and if not treated on time. So, as we know, India has almost become the diabetic capital of the world, and every 1 in 4 people are diabetic today in India, and almost 70 to 80% of these people will have some sort of diabetic retinopathy in their lifetime, and potentially 50% of these people can have some sort of vision loss secondary to diabetic retinopathy. So this is a very severe problem which needs to be addressed urgently and has to be picked up early, for which regular eye and retina checkup is a must. So for all diabetics who have been newly diagnosed with diabetes should have a retina checkup as soon as they get diagnosed with diabetes, to look for any other retinal problem, and then have a regular annual follow up with their retina specialist or an ophthalmologist for a routine retina checkup. The risk of diabetic retinopathy increases with severity of the disease of diabetes, the number of years the patient is diabetic, and over many other factors including genetics and the ethnicity of the patient. So nowadays we come across younger generation who are getting diabetes very early, and with the longer duration of diabetes they develop symptoms and signs of diabetic retinopathy at a very early age. So we need to make sure that all diabetics come to our clinics at least once in a year for a routine retina checkup, and then once they are detected with the earliest form of diabetic retinopathy, the doctor will tell you when to follow up, and it has to be strictly followed so that we can pick up the condition early, and in case of any treatable diabetic retinopathy, it can be treated at the earliest. So what are the signs and symptoms of diabetic retinopathy? Generally, in the early stages, the patient does not notice any drop in vision or any symptoms in diabetic retinopathy, and sometimes even it may reach the very late stages without even any drop in vision. And that is why screening for diabetic retinopathy and regular retina checkup is the must. So, the diabetic retinopathy can be classified into mild, moderate, and severe forms in the early stages, and the late stage is called proliferative diabetic retinopathy, where there is risk of bleeding inside the eye, there is risk of retinal detachment and vision threatening complications which may require surgical treatment. What are the most common causes of drop in vision in the early stage? In the early stages of diabetic retinopathy, the most common cause is diabetic macular edema, that is swelling developed in the central retina, which is the most important for vision. Now, this affects almost 50% of patients of diabetic retinopathy at some point in their lifetime, and this requires regular treatment and long-term treatment and follow-up. So the current gold standard for treatment of diabetic macular edema is some injections inside the eye. Now these injections help to reduce the swelling in the central location of the retina called the macula and help to improve vision. But these injections need to be repeated monthly in the initial stages, and then as and when required, depending on the swelling, how it reduces or it recurs. In the later stages of the diabetic retinopathy, vision loss can be due to bleeding inside the eye or tractional retinal detachment. The bleeding is called vitreous hemorrhage, and this can potentially cause sudden drop in vision with some kind of cloud coming over the eyes and covering the vision. The retinal detachment of diabetic retinopathy is a gradual process, and it can affect vision over a period of time if untreated. So we need to be very vigilant and aware about these relatively unknown causes of blindness, and please visit your retina specialist regularly if you are a diabetic, and make sure that you don't go blind. Thank you.